go ahead.
Norma occipitalis, here we have the occipital bone. We have the most prominent piece of bone called external occipital protuberance, and then comes down from it external occipital crest ending at the foramen magnum. On each side I have three lines. The top one may be present, may not. The lower two lines, this is called the highest nuchal line. This is the superior nuchal line. This is the inferior nuchal line. Superior nuchal line, inferior nuchal line. The last two are always present. This is the back view or norma occipitalis. If you go to the skull from a basal view, but from outside, norma basalis externa. This is your roof of your mouth or the palate. It's made of anterior 2/3 and a posterior 1/3. The anterior 2/3, this piece of bone is called the palatine process of the maxilla. This is the upper jaw or maxilla. It sends a piece of bone called the palatine process of maxilla. Posterior 1/3, this piece of bone, it runs horizontal as a plate, horizontally placed, making right angle with that vertical plate. So that one is named horizontal plate of the palate. More posterior, and by the middle, we have the posterior nasal spine. If I go lower down, this is the nasal septum we have seen from the front. If I go to the base of that nasal septum, I have what's called vomer. It looks triangular shaped area. On each side, I have two plates of bones. The most lateral one is named lateral pterygoid plate. Most medial one, medial pterygoid plate. And in between, I have a shallow fossa called pterygoid fossa. These two plates for the attachment of two muscles, lateral pterygoid muscle and medial pterygoid muscle. And then we go lower down. This is the basilar bone, the most strong piece of bone all over your body. If it fractures, chances of life are going to be like 5% to live. Openings on each side called foramina. They start with the foramen ovale, oval shape. Back to it, foramen spinosum. Medial to it, foramen lacerum. It has a lacerated edges like a lacerated wound. Back to all, I have an opening which is not open from the other side. That is the carotid canal for the artery called internal carotid artery. More posterior, I have this large, regular opening, jugular foramen for the jugular vein in your neck. And then on each side of the foramen magnum, I have the opening for the cranial nerve number 12 called hypoglossal nerve. The last opening, this is called the styloid process, this is called the mastoid process. In between, I have the stylomastoid foramen. And that's it for the